time to talk politics. It's Hardline on News Radio 930 WBEN. Now, here's WBEN's Dave Debo.
And this hour, we will continue to talk politics, look at some of the races around the area with Congressman Brian Higgins, who has been involved in some of them. Of course, the other big thing that any congressman or senator is involved in these days is health care. We'll spend the discussion this hour talking about that. Also, for that matter, swine flu is in the news again. Cash for clunkers is in the news again. Last hour, someone had a question for Congressman Higgins about China and trade and money. Anything is fair game this hour. The number is 803-0930, star 930 on the cell, or 1-800-616-9236, and that actually spells out 616-WBEN. We'd love to have you aboard, 803-0930. Congressman, thanks for being here.
Good to be here, Dave. Thanks.
Let's start with healthcare reform.
Yep.
I know in recent days you've been taking some criticism from organized groups that are out there that say, A, you need to expose more of what's in, quote-unquote, the bill, and B, you need to have a town meeting to discuss the content of healthcare reform. Point one, tell me about quote-unquote, and the reason I put it in quotes is the bill. My understanding is there really isn't one bill right now, is there?
There are three bills coming out of separate committees in the House. The Senate is debating health care reform as well. And ultimately, for anything to become law, both the House and the Senate has to pass what is referred to as same-as legislation, and that legislation would be signed into law by the President. So it's an evolving process. It's a continuum. There's a lot of debate. There's a lot of important issues that need to be discussed, and I'm talking with people about those issues.
But why not? Let's address it head on. Because I'm guessing there are people that are planning to protest one of your fundraisers later this week. Let's address it head on. Why not hold a town meeting to get this all out, pour it on the table, and say, here's what I stand for, here's what we need to have in the bill, here's where the process is?
Because I'm meeting every day with stakeholders, patients, doctors, nurses, healthcare providers, and I will be through the month of August into September and October. And what I'm looking for is a constructive dialogue about the issues that are on people's minds. I respect the fact that some people oppose healthcare reform. You know, keep in mind, a lot of this opposition to healthcare reform started before there was a bill even filed. So a lot of it's political. So you're either for the status quo, you're for what we have now, or you want a system that produces high quality, low costs. I want a system that produces highest quality health care at the lowest possible cost for people from Western New York and throughout the nation.
I don't want to diminish either side of the argument, but do you feel that there are organized efforts pushing in on both sides to try and get the outcome that they would want?
Well, there's organized efforts on both sides. Clearly, this is America. There is a debate going on, and it's good that it's a vigorous debate, and it should continue that way, because when we do healthcare reform, keep in mind, healthcare reform is not a recent phenomenon. This issue has been around for 60 years. The rhetoric is very much the same. Back in 1948, President Truman was talking about universal coverage. People characterized it as socialized medicine, a European-style type of system. That's not what we're trying to do. Here are the facts. We have a uniquely American problem that has a uniquely American solution. Last year, we spent $2.5 trillion on health care, and our outcomes, our performance was 37th among industrialized nations, and that's unacceptable. So the current system is unaffordable, it's unsustainable, and it's unacceptable. So what I'm seeking to do is find a uniquely American system. Where are they found? The Cleveland Clinic. The Cleveland Clinic is a not-for-profit medical practice which has salaried doctors. Nobody's tenured. There's 2,000 doctors and scientists working for one thing, quality patient care. And they attract patients not only from all over the nation, including Western New York, but also from all over the world. My point is very simple, that the Cleveland Clinic should not be the exception. It should be the rule. And that's the health care that I want for my family and for the people of Buffalo and Western New York.
And correct me if I'm wrong here. Earlier you said you were on the committee that's working on the bill. You're on the conference committee that's melding these two?
No, I'm on the Ways and Means Committee,
right, okay,
which is the tax writing committee.
Which created the House Democratic bill that's out there?
It created, it was the first move. It gets kind of complicated, but there were 3 committees of jurisdiction. Each one came out with different versions of bills. And you will see different versions evolving as this process evolves.
Rather than discuss any individual bill, because of the nature of the process that you just said, Tell me what your principles are, what you want in there. Under the ideal outcome,
Okay.
under the Higgins outcome, who would be covered?
Okay. First of all, you want to cover as many people as you can, because whether or not people have insurance, you're paying for it. So it's not only about the 47 million people without health insurance, it's also about the 250 million people with health insurance. And the fact of the matter is, the cost of health care is breaking businesses. It's hurting individual families and individuals, punishing them into bankruptcy because of their medical debt. We can do much better. As I said, we pay twice as much as any industrialized nation, and yet our performance is 37th out of 191 countries. That's unacceptable.
The Associated Press says that the House Democratic bill right now has a cost estimate of about $1.5 trillion over 10 years. Is that number too big for you?
It's a big number, and keep in mind about half of that will come from savings within the existing Medicare and Medicaid programs, rooting out fraud, waste, and abuse, which is in any large healthcare delivery system, and the other will be made up in new revenues. But here's the bottom line: it has to be paid for. I will not support a bill that increases the deficit.
You've been peeking at my notes. My next question: how do we pay for this?
Well, you're going to have savings in the Medicare program. You're going to have a more efficient delivery system. There will be savings inherent in that. You've got a situation currently. I think, when you look at places like the Cleveland Clinic, what distinguishes it? Why is it the highest quality health care in the country at the lowest possible cost? It's the envy of medical practices because it's a different culture there. The focus is not on profits, it's on patient quality. It's not on the quantity of services, it's the quality of services. It's not on the volume of procedures, it's the value of the procedures.
And that's something you get when you salary your doctors, you're saying?
Well, you do, and keep in mind that, every premier physician in the world wants to practice where? At the Cleveland Clinic, at the Mayo Clinic, at Johns Hopkins. Why? Because they do there what doctors do, and they take out the financial incentive that other places are producing higher costs and lower quality. There was a piece in the New Yorker magazine, Atul Gawande, who's not only a writer for the New Yorker, but he's also a practicing surgeon. And he looked at a place called McAllen, Texas.
Right. We kicked that same article around last week, but go ahead.
Okay, McAllen, Texas, the cost per beneficiary, Medicare, is $16,000. In Buffalo, it's about $7,000. So why is it that we're paying so much more in McAllen, Texas than we are in Buffalo, New York, and their health outcomes are no better? Well, I think what they discovered is there's a situation that leads to overutilization. The reimbursement is based on fee for service. So the more procedures that you order, the more money you get. Where we're trying to move toward a system that looks at the whole individual and develops a healthcare strategy to keep you healthy, so there's a lower cost to everybody that participates in that particular insurance program.
What would be the requirements for individuals under the ideal bill? There are some bills out there that say, Brian, Dave, whoever else, you have to have insurance, and if not, there will be a penalty if you don't pick up insurance. Is that under your ideal scenario?
Well, everybody, we should try to cover as many people as we can, because, as I said, if somebody doesn't have insurance, they go to a hospital emergency room. By law, the emergency room administers care when somebody is presumably sicker than they otherwise would have been if they had access to a primary care physician. You're paying that cost anyhow. So the whole idea is to get as many people covered as possible. So you will have a variety of options.
But if I don't opt in, do I have to pay?
There are penalties that you should have to pursue one of the options that are available, be it a public option or one of the programs that are outlined by private insurance. But the bottom line is you're trying to cover about 47 million people who currently don't have coverage. Let me say this also, Dave, because I think it's important. There's 47 million people that don't have health insurance. They're not poor people. Poor people are covered by Medicaid. They're not the elderly. The elderly are covered by Medicare.
Right.
These are the working poor. These are people who are working hard every single day, yet their employer doesn't provide health insurance coverage, and or they can't afford it. So it makes sense as a society to try to offer them an option with respect to health care coverage.
Tell me about the requirements then for the employer. If I am Joe or Jane businessman, not even small businessman, but Joe or Jane businessman, do I have to either offer insurance or pay some penalty and tax?
Well, employers are currently, we have a system right now that is primarily employer-based. There's about 81 million people in the nation that get their health care through Medicare and Medicaid. There's about 156 million people that get their health insurance through an employer-sponsored program. So there'll be incentives, tax incentives, to ensure that small businesses can afford to, in fact, offer health care insurance.
Is this the Massachusetts model with an exchange where people can sort of go shopping for different things?
That's one of the concepts that has been debated, but there's nothing final on it. As I said, health care reform, this is a discussion that isn't 6 weeks old, it's 60 years old. This is a discussion that continues to evolve. There is no one bill that is going to be voted on that will enact health care legislation. There's a lot of debate, a lot of discussion left in the process.
We sit here in Amherst. If I want to buy some plums, I can drive to the Clinton Valley Market in Buffalo, or I can shoot up Millersport to the market just on transit there. I can cross county lines to buy my plums. Should I be able to cross state lines to buy my insurance? If there are more places I can buy my insurance from, presumably it would be cheaper, right?
Look, I think this is about competition and choice. And there are no mandates that people have to take this coverage over another. I think what we're trying to do is introduce more competition so that we get a better product. The fact of the matter is we have very, very efficient and effective healthcare providers in Western New York. If you look at Independent Health, if you look at Health Now, if you look at Univera, they are very aggressive about doing the right thing. They're encouraging healthy lifestyles, and health economists will call this the disease burden.
Sure.
70% of our healthcare dollars consumed by treating chronic diseases that are influenced by obesity, by diabetes, by lack of exercise, by smoking. And if you look at the Independent Health, the Health Now, all the others, they're promoting prevention very, very aggressively, and this is something that the whole country has to move toward, because if we don't promote healthier lifestyles, then the healthcare cost and the burden is just going to continue to increase.
We've got our back up against a commercial break. The phone lines are starting to fill up. There is one line open, 8030930. After the break, we'll start to take calls. Really quick before we go to the break, in as simple a term as you can, tell me about the idea of a public option. Are you advocating a government-run program here?
No. Here's what I want. I want a not-for-profit public option that is modeled after the Cleveland Clinic.
Subsidized by the government?
No. I want
encouraged by the government?
Okay. I want it to be self-sustaining. I want people that go into that plan, who choose to go into that plan, to want to go into it because of the quality that it provides. And my hope is that a not-for-profit plan modeled after the Cleveland Clinic, the Mayo Clinic, and Johns Hopkins influences changes in the private insurance industry. That's what this is all about. Higher quality, lower costs.
And that's a template that you could lift up from Cleveland and place nationwide.
That's the template we could lift up from Cleveland and place nationwide, because it's all about changing the culture. It's getting away from fee-for-service that drives utilization, that leads to overutilization. We do 60 million surgeries a year. 100,000 people die from complications from surgery, more than that die in car accidents. For every medical procedure, there is an inherent risk. The Cleveland Clinic has comparative effectiveness research. It basically says, here's your problem. Let's say you have arrhythmia, an irregular heartbeat.
Sure.
Here's what it is. Here's what the symptoms are. Here's what the causes are, and here are the treatment options. All of this information is available online at the Cleveland Clinic. Doctors are able to communicate with each other. Doctors are able to communicate with their patients. You can get a second opinion at the Cleveland Clinic online. It's all about patient quality, and I think when you look at the level of care that Americans want and what reform must produce, it's the best. Because we're paying more than anybody else, we should have the best, most efficient, most effective healthcare delivery system in the world.
All right, let's take some phone calls as soon as we get back. This is Hardline on News Radio 930 WBEN. More with Congressman Higgins right after this.